at the slide there at the bottom. Okay, so just a couple of slides on the NHMA campaign. We are supported by the Centers for Disease Control and Prevention. We started in February.
Okay.
February 2021. And the Vaccinate for All, we just decided we were part of the Ad Council campaign in December and January. And the Ad Council and other campaigns that got started early on were really focused on the importance of getting a vaccine as an individual. And we thought, you know, in our communities, it's the family that needs to get vaccinated. We really wanted everybody to know that, and that's why we called our campaign Vaccinate for All. Can people please mute their microphones? I don't know if you can do it, Vincent. So we have champions that we offer the opportunity for both individuals and organizations to join us in passing on information through social media to develop champions or ambassadors. We're asking you to make your own little film, videos. You know, so much of social media messaging now is done virtually, by video. And I think it's important to have short messages. And also we're looking for speakers for our NHMA conferences and our on-the-ground events in local communities across the country. We're working with Univision and Telemundo and others. Next slide. I think what's important about the champions, and this is just to show that we are putting up high resolution pictures like this. This group is from El Paso, Texas. They work in a clinic. Dr. Bert Johansson in the middle there is on our board of directors. And we're very much interested in getting more content on our monthly newsletter website. And we have also a portal that we'll talk about in a minute. Next slide. So we support champions. Again, we are very interested in helping you become a champion, whether you're a pre-med student, public health student. It's so important to get out there and help our communities. Next slide. In terms of training, part of the program is to develop our leadership fellowship program. We're actually starting next week, every Friday afternoon from August until December. We have 20 physicians from around the country. We are training on how to work with the federal and state public health governments, leadership skill building, and also how to do policy analysis and work with your senators. We're going to have speakers from the same states that the doctors are coming from. And we also have monthly leadership discussions, and we invite those that are leaders. You don't have to be the president like Dr. Aparicio and Dr. Mancini, but we are inviting the leaders from our partner organization that we call Hispanic Health Professionals Leadership Network, the nurses, the doctors, the dentists, public health, et cetera. And then we also have an NHMA Council of Medical Societies and Latino Health Advocacy Organizations. And we've been meeting once a month with the White House and other leaders from HHS. Those meetings are the first Tuesday of the month. And then we have grant awards. We have small amounts of money for our chapters. Our chapters are in these cities. If anybody out there on the call is near one of these cities and you'd like to get involved with our chapters, just call our office and let us know. We'd be happy to connect you. We're looking for local events that the chapters can actually get funded to have, volunteers, use some funding for helping with staffing or volunteering to get to our local community events in these cities. Next slide. And I think this is the last slide. And basically our grant also has supported us to develop a hub, hispanichealth.info. We have had it in the past. It's being revised to have patient information as well as professional information, English, Spanish, and in this case on COVID-19, but we will also have information on heart disease, obesity, diabetes, et cetera. And what's important about this is that we invite all of our partners to help us with finding fact sheets and information. The whole idea was to have one place to go to for our doctors and nurses, dentists to print out fact sheets and information, and links to CDC, of course, and to all the major research institutes that have information on COVID-19. And I think that's it, right? Oh, this just shows our impact to date. We've had over 3,000 people register for these events, our COVID webinars, and you can just see all of the different, we've also been media training so far 15 physicians. I know the past chairwoman was just on NBC TV in New York. Of course, Dr. Shapiro's been has done a lot in Univision in Los Angeles. And there are quite a few doctors that are actually getting more play because we decided that we not only would do media training, but media placement. And we're funded for 5 years to do this. And we're going to build up the visibility of Hispanics within media. And again, just to join our coalition, if you go to our website, nhmamd.org/vaccinate for all. And thank you. So now we're going to have Dr. Maldonado give her presentation, and Vincent will change your slides, Bonnie. Thank you.
Wonderful, thank you. And thank you, Dr. Rios, and to the other members of the panel today. It's really a pleasure to be here. And I'm going to start off by just giving a really brief, hopefully brief overview of some of the facts and a little bit about what we know about the COVID-19 disease in children, that is people under 18, as well as what we know about the vaccines. And then we're going to talk a little bit more about messaging, et cetera, with the question and answer session. So if I could get the next slide, please. So first of all, I just wanted to give you an update on where we are with COVID. This is from the New York Times, but you can pick pretty much any website to look at the numbers. And what you see here is that we have had 3 surges really, and we're heading into another one right now there at the end of the tail of the graph. Right now, as of today, this data is 3 days old. 3 days ago, we were just catching up to where we were a year ago. And today we actually have more cases than we did a year ago. So we're heading back into another surge, which hopefully will end, but we have to be prepared for the fall as well. And I'm not going to say too much about the Delta variant, but it is quite infectious. And essentially we're being driven at this point by unvaccinated people, especially young people. So can I get the next slide, please? So here's some early misperceptions about COVID-19 from early on last year, which was that children do not become infected by SARS-CoV-2, they do not develop symptoms, and they do not transmit SARS-CoV-2. These are all false statements. And I think you can be very clear when you can say to people that this is absolutely not true. So if you can see the next slide, please. What we do know is that pediatric burden of disease in the United States is significant. There's a disproportionate health disparity among children in underrepresented communities. There are also indirect effects to the child and to society at large from COVID that have to do with school absences, school deficiencies, neurodevelopment, cognitive development, and mental health issues. So clearly this virus has other impacts.
If you double check.
I'm sorry, could you please mute yourself? Please mute yourselves, please, thank you. And if we are going to wait for people to have natural immunity, which is what we're hearing some people advocate for, we are going to see hospitalizations and deaths. So natural immunity is not what we do. It's like saying we shouldn't vaccinate children against measles or whooping cough or other diseases. It does work for some people, but for others, it is really going to lead to hospitalizations and deaths. We know that vaccination reduces or prevents asymptomatic carriage, so therefore we can reduce the pandemic, and safety data are best collected in clinical trials. We also know that adolescents and children under 18 represent 1/4 of the US population. So if we really want to affect major change, we need to develop vaccines for children, especially those under 12, because right now we have vaccines for older children. Next slide, please. So this is a lot of data here, but I just wanted to point it out to you. This is from the American Academy of Pediatrics website. I'm the chair of the Committee on Infectious Diseases for the American Academy of Pediatrics. And this is put together by the AAP at aap.org, and you can get a lot of COVID data resources from that website, and so can families that you may be caring for. What we know at this point, though, is that about 4 million children have already been reported to have COVID-19 infections since the beginning of the pandemic, with over 16,000 hospitalizations reported from the 23 states that actually report by age. So we know that that number is much higher than that already, and that at least 300 to 600 children have died from this disease. So again, not the same numbers that we're seeing in adults, but this is still the 10th most common cause of death in children, because the number of children who die every year before COVID is about 20,000 or less. So it's a significant impact on children. Next slide, please. What we are seeing now is that since the beginning of the pandemic, at least almost 8 million cases have been reported among people 12 to 29 years of age. So that overlaps with the Gen Z population. You can see there in the red box that the highest rates per 100,000 population are in the 12 to 29-year-old age group. Next slide, please. And if we look at the proportion of people getting infected, because people over 65 and even people over 50 are getting more and more vaccination rates higher, we are seeing that people under 29, between 12 to 29 are making up more and more of the population who is infected. So the light blue bars are graph area is 12 to 29 years of age, and the next light orange is 30 to 44. So 1/3 of the population in the US now who's infected are people between 12 and 29, who, by the way, can be vaccinated. Next slide, please. And similarly, if you look at hospitalizations by age, you can see at the blue 12 to 17 years of age, in the red 18 to 24, and in the green 25 to 29. The rates are between 1 and 7 per 100,000 people, which is quite substantial. And those numbers are not really going down. They're leveling out a bit, but they haven't dropped off. Next slide, please. And then when we talk about deaths, we've seen overall, I mentioned there have been about 300 deaths in children under 18. But if you look at overall 12 to 29-year-olds, it's almost 3,000 people in that age group have died. And you see they really do overlap again with the Gen Z population. Next slide, please. And then finally, we, in terms of the clinical impact, we have multi-system inflammatory syndrome of children, which is MIS-C, which is a severe hyperinflammatory syndrome that is thought to occur a few weeks after acute or asymptomatic infection. 2/3 of these children are actually admitted to the intensive care unit, and many of them with really substantial shock symptoms, with a 1 to 2% mortality rate. So far, over 4,000 cases have been identified in the United States, and they've been identified all over the world as well. And we don't have a marker to figure out which children are at risk for this. So that's a problem. We can't identify high-risk children for MIS-C. Next slide, please. And when we look at the data around MIS-C prevalence, it's tracking the pandemic. So you can see in the dark blue line, those are MIS-C cases, and they tend to occur about 2 to 6 weeks after the highest levels of infection. They are trailing off at this point, so we're glad to see that, and we're hoping that those numbers will stay down, but we have no way of knowing why children get this syndrome and which children are at risk. Next slide, please. So now I want to talk about COVID-19 vaccines and therapy for adolescents, and a little bit about children, younger children as well. Next slide, please. So the goal in the US was to have a SARS-CoV vaccine or vaccines for the whole US population, including resources for vaccine trials in pregnant women and children. And those are ongoing, as we all know. These protocols have all been approved and are done under the supervision of the Food and Drug Administration, as well as other US government regulators such as NIH and CDC. Next slide, please. And at this point, we know that only one vaccine is available. That is the Pfizer vaccine, which is available for persons 12 years of age and older in the US under FDA's emergency use authorization. Next slide. And here's a little graph showing you where we are with the vaccines so far. Now, currently, as you know, only Pfizer, Moderna, and Johnson & Johnson vaccines, the first three columns there, are vaccines licensed for use in the United States. AstraZeneca and Novavax are also in the run for approval, but have not received approval yet in the US. And you can see that for the Pfizer vaccine, it's approved currently for those 12 and older, but Moderna and Johnson & Johnson are approved only for 18 and older, but there are trials ongoing. We here at Stanford, in addition to other sites, are doing trials for 5 to 12-year-olds and children under 5 for the Pfizer vaccine, and there are Moderna trials going on as well. Next slide, please. And here's the status of COVID-19 vaccinations in the US. Overall, about 49% of all the entire population is fully vaccinated, and up to 89% of people 65 years of age and up have at least one dose. So that's the range of protection. We know that one dose is fairly protective, but not highly protective. And we know that one dose is poorly protective, in particular against the Delta variant, except for the Johnson & Johnson vaccine, which is still very effective against the Delta variant. What we know as well for children is that the children under 18 have received a total of 9 million doses of vaccine, with about almost 7 million of these children being fully vaccinated. But since May, the number of new childhood vaccinations has really slowed down, and we really need to have our young people vaccinated with these safe and effective vaccines. Next slide, please. So let's talk about risk and benefits. So these are slides from CDC, and the benefits were calculated by looking at estimated numbers of cases and hospitalizations prevented by the mRNA vaccines by age and gender. And the potential harms were the cases of myocarditis, because that has really been the only signal, safety signal seen after vaccination in young adults and children. Not in children yet, in young adults. Next slide, please. So you can see here as a summary slide, for every million doses of mRNA vaccine given, you can see that there are substantial numbers of hospitalizations in the blue bars prevented on the left, and the number of myocarditis cases on the right is extremely small, on the order of very, very rare. I can show you more detail in the next slide. So if we look specifically at the 12 to 29 year age group, for every million second dose vaccines, because we had identified a signal that indicated that there might be myocarditis or inflammation of the heart muscle after the second dose of my mRNA vaccines in young people, you can see here that for every second dose of vaccine given, that you will prevent between 5,700 and 15,000 cases of disease, between 183 and about 1,500 hospitalizations, with up to 200 ICU admissions and up to 13 deaths prevented. And if you total up all of those numbers by age group and by sex, you actually wind up seeing that you are preventing 70,000 infections, over 4,400 hospitalizations, with over 600 ICU admissions and 36 deaths, with about 130 or so potential myocarditis cases. And we just did grand rounds yesterday at Johns Hopkins with a colleague who did a case series of children who had myocarditis after the vaccine. These were very mild cases. The children went home within 2 to 3 days and were extremely mild cases, not related and not similar to what myocarditis cases that are seen with the actual disease, which are much more severe. Next slide, please. So in additional considerations in males between 12 and 17 is that we can also think about prevention of MIS-C, prevention of prolonged symptoms, and protection against variants. We know that at this point, even though there are breakthrough cases of SARS-CoV-2 and COVID-19 disease among vaccinated people, it's really the unvaccinated people that are being hospitalized and that are dying from this disease at this time. Next slide, please. So at the population level, there are no alternatives to mRNA vaccines for the foreseeable future in adolescents. Vaccination of students offers an added layer of protection and an important tool in returning to school and normal activities. Higher levels of vaccination can lead to less community transmission, especially since a quarter of the US population is under 18. And finally, we know that there's a significant racial and ethnic health disparity in terms of cases of being overrepresented in Black and Latinx communities. Next slide, please. So what does the future hold? Well, we still have to think about more treatment options. We don't have very good ones at this point, but combination therapies will likely be the best thing to use for actually infected individuals. But the best future is to vaccinate the population. Herd immunity is the ultimate goal, but may not happen rapidly. And non-pharmacological interventions really continue to work. Now, it's interesting, this slide I made up a year ago, and it's still true. So that is, vaccines are still the best prevention, but masks and distancing can work. It's just that if you can add additional protection with vaccines, you should consider that strongly. Next slide. And so in summary, we know that COVID-19 incidence, hospitalization, and mortality rates were starting to decrease overall. However, now that the variant, the Delta variant, has started to spread, it now makes up 83% of all cases of COVID-19 in the US. And we are going to see more cases, and we are seeing that adolescents and young adults are growing proportion of cases, given the vaccine coverage among adults is so, older adults is so high. Post-COVID-19 conditions also impact adolescents and young adults, including MIS-C, and myocarditis is a disease marked by inflammation of the heart muscle. Risk factors in vaccinated people, as well as from actual COVID-19 disease, are younger age and male sex, but with disease compared to vaccination, myocarditis is much more frequent and is much more severe. And finally, myocarditis after mRNA vaccines are noted with the highest frequency in males 12 to 29, but the risk is in the order of dozens or less than dozens per million doses administered. So I'd like to stop there and hand it back to Dr. Rios.
Dr. Rios, I think you're muted.
Vincent, can you take that slide down and just go ahead and bring up the panel? Okay. So everyone, if you can please put in your questions in the chat. I'm going to start with a few questions while people get to the chat. Dr. Maldonado, you gave us a great presentation with a lot of statistics and a lot of data. Just a question about the future. You mentioned how the children, there are cases of children dying and hospitalization. One of the questions that came up was, are most of the children that die, do they have chronic illness like the adults?
Yeah, so I didn't want to, I have a lot more slides, but obviously we wanted to take questions. So about half of all of the deaths and hospitalizations in children are among children with chronic underlying conditions. But importantly, the most important one by many percentages higher than the next second most common is obesity. Obesity is the biggest risk in children and adults. And it is so prevalent in our communities that it's really hard to just say underlying conditions are the driver. And we have half of the children who are hospitalized and who die, who have no underlying conditions. It's very similar to what we see with the flu vaccine, the flu disease as well, where half of children who die from flu have no underlying conditions.
Okay, and you mentioned obesity, and I'm going to go to Dr. Oliveira to talk about her patients and because we were talking earlier this week about the importance of what type of patients she sees as a pediatrician in Chicago. And Dr. Oliveira, do you want to talk about how do you talk to families that walk in that are obese? You know we have to have role models in our families and to get the kids to exercise. And it's so hard for that to happen. But you as a doctor who takes care of families, but especially how do you get them to understand the importance of COVID-19, given what Bonnie just said, Dr. Maldonado just said about that being a very big risk factor?
Yes, that's a great question, Dr. Rios. And I think Dr. Maldonado did a great job at highlighting really what we talk about in the office, risk versus benefits and returning to schools. So really, when we talk about that, returning to school is so important because we've seen, from a psychological standpoint, children are more down, anxious, and they're not seeing their peer groups like they were before. And many, due to remote learning, have been, doing their class, they're on break, go to the fridge, open the fridge, grab something. And then on it goes, and they don't have any access to go, a lot of families were scared to go to the park, take their children to see other friends, or even play with the neighbors. So they weren't doing any physical activity for about a year. A lot of my patients have gained 30 pounds in the past year. And these are little ones. We're talking about 5-year-olds, 6-year-olds who are in kindergarten, and also the high schoolers who aren't doing the activity that they were prior due to gym classes and just going from one class to the other. We don't really, going from your bedroom to the fridge is not exercise, right? So really focusing on realizing that parents are also having a hard time. Some have lost their jobs. And so, being in areas of food deserts, not being able to access healthy foods has also affected what children get from the refrigerator, right? So I give tips to parents in terms of that, understanding that kids need a snack and will graze, that have options like fruits, vegetables that they can put in a Ziploc bag, and the child can get it like a bag of chips that they would eat. And so having that access to healthy fruits and vegetables is key. Having them go outside and play. Older kids, I've talked about getting a Fitbit or something like that. All of them use their cell phones now, and a lot of cell phones have access to counting steps. So kind of doing that as a family, walking together and, doing those kind of activities. But really, when we talk about getting the vaccine, we want to talk about this is not new technology, right? This technology has been around for decades. So making families understand that this is something that is safe and effective. What Dr. Maldonado showed, how numbers were decreasing because many adults were getting vaccinated. We're always talking about risk versus benefit. And these slides did a great job in highlighting that. Really, when you talk about what are the symptoms that most children get after getting vaccinated, or teenagers, it's sore arm, maybe a little fatigue or tired, they take a nap, which is similar to what they get with any vaccine. We're talking about, this is what we counsel parents on when the babies get their 2-month shots, that they may have soreness, they may be fussy, cry, and get a fever. So these are things that are treatable, that last 1 or 2 days in general, and have the benefit of protecting their child. So that's the number one thing. When we're talking about this technology, using terms that teenagers understand, this Generation Z, mRNA is similar to Snapchat, where you have, someone sends you an image. So the vaccine sends you an image of what COVID can be like, and it degrades the message after 24 or 48 hours, just like Snapchat. So using that, understanding that this is not something that affects the DNA, that this is something that our body will take as a message, that once they encounter COVID or SARS-CoV-2 virus, they will be able to protect themselves from going to the hospital and dying.
Okay, so thank you, Dr. Oliveira, for all of those pearls of wisdom from your training, and I mean, from your working as a doctor in Chicago. Let me switch over to Dr. Mancini to talk about the wellness of our young people. And I'm first going to ask you about Snapchat, because you mentioned earlier that you have 2 Gen Z children. And anyway, you need to tell us how you communicate with your children first. But I wanted to just go ahead and continue with this line of thought about how do we take care of Latino families by giving them positive messages and information that they need to know about, from all the information that Dr. Maldonado said. I mean, how much of that information gets to our Latino families for their kids? Mhm.
Thank you so much, Dr. Rios, and thank you, Dr. Maldonado, for that beautiful presentation. And Dr. Oliveira, it's funny you mentioned Snapchat, because recently released reports show that Snapchat is the most popular social media among Gen Z populations, and then they're closely followed by TikTok and YouTube. Now, Dr. Rios, you mentioned my children, and I wish I knew how to get a hold of my children, but I know that in the extreme cases, my older daughter can get a hold of my younger son through Snapchat. I have been prohibited to joining Snapchat due to my age by my children, but we need to go where the kids are. And what is important for us to be able to understand and to know is that this is a generation that has been raised in a very ever evolving world. So what they are really valuing is they are valuing transparency. They want to know what's what, and they want to know the truth. So the presentation we just saw has very concrete numbers, very concrete examples, very concrete statistics. And that's what this generation wants to know. They don't want to listen to something and then find out that that was only part of the information. They suspect dishonesty, especially from age groups that are different than theirs. And to communicate with them, it has to be something that is specialized. They want to have this personal communication. And we have to remember that if we're not concise, if we are not visual, if we don't communicate within 6 to 8 seconds, we've lost them. That is the attention span that this community counts with, and they work in multiple platforms. So we have to be able to reach them in a very busy visual environment. And what's happened, which is interesting, that obesity is one of the biggest problems, because in my world, what we're seeing is tremendous increase of this community of young people and their families that have experienced increased anxiety and depression and suicidality. And poor appetite is actually one of those symptoms that we're seeing. So we may have people that are overeating to try and comfort emotions, not necessarily because they're hungry, but we have isolation as one of the biggest problems, and kids end up going to their corner of the apartment or the home with their social media, with their phone or their tablets, and they have this closed world that they communicate with. And we see increased irritability, and we see fear from this community. They also have this disconnect. So just like I mentioned my personal story with my children, there is a disconnect of where they get information and where their parents get information. And one of the studies that I used to quote frequently when I had my prevention program, there was 80% of parents that would report they spoke to their children, in this case was about alcohol and drug prevention, but it was 80% of children that said their parents never did talk to them about this. So somewhere in there, the information is not going from point A to point B. And we have specifically LGBTQ plus communities are experiencing the highest cases of anxiety, depression, and serious thoughts of suicide during this pandemic. So to reach them with this critical information, we have to also be able to do it in a way that they understand, that is clear, transparent, concise, concrete, and in one of those mediums that we just mentioned.
Oh, very good. Let me pick up on what you said about a disconnect between parents and children. And Dr. Aparicio or Dr. Maldonado, would you like to comment on, have you seen kids or children that want to get the vaccine, but their parents don't? Or vice versa?
Yeah, I can tell you that we do have, I think more than anything, I live in the San Francisco area in California, and we just have a pretty high vaccination rate here in the state overall, and especially here in the Bay Area. And I would say that it would probably be more likely that the parents are pretty excited to get their kids vaccinated. So it's really a matter of what I've seen families do is really try to engage their children. And as you heard Dr. Mancini and Dr. Oliveira talk about, is just being honest and transparent with the kids, talking with them about what you know. And if you don't have the information as a parent, there are resources through groups like Dr. Oliveira's or other groups. There are national organizations that have resources for families. There's a website called healthychildren.org where you can get information for your children or that you can read and share with your children. It's really just getting them prepared. We haven't seen the opposite so much here in the US, in California, but I'm sure it's happened. I don't know if Dr. Aparicio has any examples.
Yeah, Dr. Aparicio, from the public health perspective, public health departments in the states developing their statewide campaigns. Do you have any comment on the importance of information for parents as well as their children?
Right, yeah, information and education are key in public health. And then we had this battle against misinformation that we are getting in the US and all over the world. And people being in social media. So the information people are getting in the US is not coming only from the US, but it's coming a lot from the countries of origins, from all over Latin America and from other countries. So that's another thing that, we see that a lot. And that actually connected it to parents. A lot of that information, it's information that parents are paying more attention. Generation Z that mostly born in the US or grew up in the US, so they consume more information from the US. But the parents, a lot of the parents a lot of them are connected with the country of origin, and also Spanish is they feel more comfortable reading information in Spanish. And there's not that much information in Spanish in the US or channels that are available, but they're connected to the sources in their home country. So they're getting that information for the home country. And a lot of that is not accurate information. And so in public health, so that's one of the things that every public health institution is doing, is trying to bring accurate and up-to-date information, to the patients, which includes adults and children. And that's always kind of a back and forth in a game, because when information that might not be appealing to an 18-year-old might be appealing to a 6-year-old or a 10-year-old or a 30-year-old. So it all depends, what age range you are, what generations you are. So that's the kind of information will appeal to you. And that's what this Discord also with Generation Z, like, my generation or our generation feels very comfortable getting information from reliable sources, medical magazines, or we like to read the New York Times, or other sources that we know are reliable. But Generation Z gets their information from TikTok, from Instagram, from Twitter, and they don't even know who the sources are, or what the credibility of the sources. But that's where they get their information. So in public health, that's actually a challenge, especially if we are from a different generation, is how do we adjust and how do we adjust to that new generation, with the generations looking for information. What we're doing with the Latino caucus is actually that 2/3 of our members are students and young professionals. So those who are my age or older, so we're more relying on those students and young professionals to guide us, because it's a territory we actually don't know. And what is the best way to reach out that generation, and how to present information that they can relate to, that they can understand. So we rely on our students and young professionals in the Latino caucus. Now, with the question with parents and children not agreeing, we don't have data that I know about, but just from talking to people and from experiences, we see and we hear adolescents or people under 18 who wants to get the vaccine, but the parents are opposed to it because of the information they're getting, mostly from their home countries, where they're going to develop diseases, or or it's a microchip they're going to get and stuff like that. So even though they want to get the vaccine, the parents are opposing. Don't have data, but it's just based on observation and conversations with different peoples.
Well,
Yeah,
let me just mention another thing though
sure.
around that issue, and I think my colleagues here all know this as well, but I think we should point out that Latinx populations are proportionally in many parts of the country the least likely to be vaccinated right now. In California, for example, it is the biggest population that's not vaccinated for a number of different reasons. And if they are not going to be vaccinated, they're not going to encourage their children as well. Some of the misinformation that we're hearing, for example, I think many of you heard about the TikTok challenge, where people were saying that they were magnetized from the vaccine and that they could stick metal things to their arms where the vaccine had been given, demonstrating that they were magnetized had a magnetic chip in the vaccine. So that's one thing that actually was propagated on TikTok. It was very highly viewed. The other thing that's very common in many communities, but in our Latinx communities, is the misinformation that the vaccine can cause infertility, either currently or in the future. That is absolutely incorrect. That's based on incorrect speculation by a German scientist. But we also know, and somebody put this in the chat, that there are absolutely well-known misinformation sites that make lots of money. I've been working with vaccines for 30 years, and there are many organizations out there that actively campaign against vaccines, and they make money from natural remedies instead of vaccination. And one of the groups has really been pushing this idea that the vaccine will make you infertile. The CDC and the FDA have reviewed data. We've looked at it. There is no fertility impact of the vaccines on any population. So that's a big concern that comes up among all our populations, especially among our Latino and Latinx communities.
Yeah, I'm putting the cdc.gov in the chat. There is a lot of myths and a lot of facts that CDC has on their website. You just search for COVID-19 and you'll get a lot of great positive information. Bonnie or Dr. Maldonado, I was going to ask you one other question about this data that you mentioned about so many children getting the myocarditis and how do you tell people that and let me just put it in context, the administration just gave out millions of dollars to community-based organizations to start going door to door and to start talking to people in churches, and the promotoras in California got $1 million. I mean, just all kinds of community-based organizations got a lot of money it was just announced today. And so we're going to have a lot of people going to the Latino families knocking on doors. How do you tell the young families with children if they hear about these, horrible diseases and are frightened about getting a vaccine?
Right. Well, I think one of the best things to do is, again, to really do what you just said. And we know that trusted community leaders are people that will be listened to. We have data from surveys that have been done across the country that demonstrate that pediatric providers or primary care providers in CBOs or other community-based settings are still much more likely to be trusted than any other groups in one's community. And so that's why having our providers present this information, make sure they answer the questions of these families. And the other thing I really didn't have time to point out is when you look at the hospitalizations and the deaths related to COVID, even though they're not in the hundreds of thousands like adults, I think people say, well, the kids aren't going to get that sick, so let's let them get sick. I mean, in our hospital here, we've seen hundreds of children hospitalized with COVID-19. And not all of them have died, fortunately. We've had very few deaths, but why would anybody want their child to be hospitalized for a disease for which we don't know the long-term side effects? We don't know how long COVID effects will last. And yet the risks right now are from the heart inflammation are, again, on the order of maybe a dozen cases or so per million doses given. And those people, those children, there was just another study that came out this week. Those children the ones who have myocarditis from the vaccine have very mild illness. In fact, it's thought that many of them don't even have symptoms that require hospitalization. They're treated, they get better very quickly. Whereas we know that the data from COVID is that the SARS-CoV-2 virus can cause very severe inflammation of the heart muscle and obviously other organ damage. Somebody put in the chat box, for example, that you can have indirect effects. So we know that the rates of type 1 and type 2 diabetes are double. They are double what they were before the pandemic. And we are seeing children. I have colleagues here who are endocrinologists who said, one of them said, in my 46 years of being a doctor, I have never seen families of children who developed diabetes after COVID infection, and they're seeing that now. So the numbers haven't been shown for children as much. There are more case reports, but we know that other organ damage because of the inflammation can lead to things like COVID related diabetes, for example, cardiac disease and brain cognitive impairment. So what we try to do is explain that the vaccine itself is quite safe. Oh, one other thing is over 1/3 of 1 billion doses, 340 million doses of vaccines have been given in the US. No vaccines have been tracked to that extent in the history of medicine. We have never tracked the vaccine as carefully as we have here, and the signals are incredibly safe. So the risk of a severe outcome for a child, while it's not high, is much higher for a COVID infected child than it is for a vaccinated child.
If I may,
So go ahead.
yeah, I think it's really a collaboration between medical providers and community workers like promotores, because people that have access to hospitals and medical providers, it's a bit limited for many different reasons. And the time that doctors have to see a patient is around 15 minutes each. So there's it plays some limitations there. But the collaboration between medical providers and promoters really provide exponential positive results, because it's about trust. And as Dr. Maldonado said, they trust the medical provider, but they also trust their people from their community, people who look like them, people who speak like them, and who also have the ability to spend more time with them at their home in a place where they feel comfortable. So the role of Promotora de Salud, I think, is really very important in collaboration with the medical providers in getting patients to get vaccine.
I think a team approach is important and
Right.
everybody be on the same page.
Right.
And let me just ask Dr. Mancini about the messages that you would provide to the school nurses as children go back to school. Again, we're talking about Gen Z that could be 12 years old and up. I mean, I shouldn't say that. They can be vaccinated if they're 12 years old and up. So hitting the middle schools, let's say, with school nurses. One of the issues that has come up, and you mentioned this, with anxiety, and young kids having anxiety about getting a shot. What would you tell school nurses if you had to tell them the way to talk to the young people?
Thank you. And, I think the key to this is one of the problems we had in reaching these communities when schools went virtual. We lost access to communicating with all these children. And now we're starting school and we're still divided. I live in Georgia and we have schools where you have to wear masks and you have to be vaccinated. And then you have schools where you don't have to. And there's this great disconnect about them. So we need to be able, and then before I forget, because Dr. Aparicio and Dr. Maldonado mentioned, in talking to parents, we have to remember we had about 67% of some parts of Latino communities that lost their jobs. So, right now, priorities at home may be food on the table or a vaccine. So it gets that critical of how we need to communicate and equip the parents to be able to make these decisions. And the outreach. And one thing we often forget in Latino communities, we're not homogeneous. So everything that I do when it comes to reaching out our communities is in English, Spanish, and Portuguese. And we have to make sure that we are able to communicate in a way that they can understand us. Now that we're going back to the schools, one of the movements that we keep pushing at a national level is school-based mental health. So if your school is blessed enough to have one of these programs where you have mental health professionals in the schools, they're partnering with the nurses and that integration of physical and behavioral health is critical, because for this population, the accuracy of the information is key. We can't talk to the children, but you can trust that as soon as they leave your office, they're going to Google whatever you told them. And then whoever has paid Google more money to be on top is what they're going to read first. So we need to be able to educate them. We need to be able to empower both the nurses and the students with the tools to find the right information. My kids, and one of the greatest things that I know that when I'm long gone, I hope they say, one of the greatest things he did is to teach my kids to be independent thinkers. So if they read something in a newspaper, if they see it on the internet, or if they go to a movie and whatever, is for them to find two other resources and said, okay, who else says this, or who else is talking about this, and what information do they have? Because we need to be accurate with this community. And if we mess up, which we're all human, and we're gonna put something out there that is disproven, we need to own it right away. We need to say, hey, listen, last week we said this, but we just discovered this. And that is how this community is going to respond to whether they're going to be able to take the vaccine. And never underestimate the information a middle schooler gets in school. We had many youth that took the information we provided in our prevention programs and went home and were telling their parents, hey, this is what's going on, and we need to be able to do this properly.
Yeah, no, we actually have one of our doctors put together some children's books on COVID-19, and we're shipping them to different school districts with a new grant that we're getting, and to that point. Let me just ask, I'm going to just ask all of you to respond to this question. For the Latino community, there's a lot of immigrants in our community and a lot of undocumented. And the government, has made a big push to help our communities. As Dr. Maldonado said, that it's probably the first time in medicine and in history that the vaccine story is more inclusive of trying to get everybody. I mean, maybe since polio, or since smallpox. There's just a very big public health push and leadership is there. But for the undocumented who are marginalized in all of our different communities, the farm workers in the rural communities, the US-Mexico border and the detention centers, and even in our cities, you know, in where we have so many different undocumented from Latin America and Mexico. What do you tell the families and to make them feel more comfortable, but also to get the vaccine? And this is again, for the Gen Z, but for the parents too.
So one of the
Bonnie?
things that we did here at Stanford in California is the first thing we did last year, right after the lockdown, is I reached out to my colleagues at federally qualified health centers in the area. And I reached out to our Office of Community Engagement in the medical school, as well as our community engagement team at our hospital. Because as you can imagine, we're a tertiary quaternary care medical center. We're not going to find those individuals, but we can support them with information, with resources. We reached out to our community members and asked them how we could team up with them. And we helped them build, before we had vaccines, we helped them build information sessions in Spanish. And we didn't have a lot of Portuguese sessions here, unfortunately, but you know, we have other, for example, many Asian languages too. So we had panels of individuals who would come out into communities, work with the promotoras, work with a lot of our CBOs and our FQHCs, and really help them distribute information, have evening and weekend events, outdoors if we had to. And back when it was really shut down, we would do it all virtually with as much input as we could to bring people on board, because we know that they have little internet access. But these community centers really know how to reach their population. We help them set up testing sites so that they would understand how to get to their communities. And we also partnered with the California Care, which is our kind of version of ACA, and with Second Harvest Food Bank. And so when we would have testing drives at the different community areas that not at Stanford, but as far away from here as we could get, because frankly, people didn't want to come here. They wanted to go to their communities. And so at the tent where we would do testing, of course, we were all wearing PPE and all of that, but we had other little tents where there were food boxes for families to just take, whether they got a test or not. We just left, you know, people there to give them what they needed. If they wanted to sign up for California Care, just partnering with as many nonprofits and other organizations from the public health department as possible. And that really built some early inroads into the trust in the community. I know this was an opportunity for us in an academic center to partner in communities in ways that we hadn't done before. We were receiving, for example, restaurants and other community groups wanted to donate money and food to our healthcare workers. And clearly the healthcare workers needed the rest and the food. But we apportioned some of that away to give to our community members who needed immediate assistance. As you heard, people were just losing their jobs. And then when the vaccines came along, we transitioned some of the testing sites in the communities into testing and vaccination sites. We got the vaccine because it was hard to get. I don't know if you remember this, but at one point it was hard to get vaccine. Now it's everywhere, and we're trying to get more people to get vaccinated. But we would get the vaccine from the counties, but we would provide the healthcare workers to come and do the vaccinations and to help translate, and also the community based organizations and FQHCs would hold these events in their own communities. So really it comes down to just that last mile is the hardest mile. And you have to just do, it's a lot of hard work and making sure you're communicating with people who are in touch with the local community. We went to migrant camps that weren't even on a map because we weren't allowed to publicize them, and ask people to come, if the migrant families and the workers, and we came to them, and I know their hours were off hours, so we would come whenever they were available to come and vaccinate them in their communities when they were available.
Let me ask each of you, we have about 5 minutes left, 10 minutes left. to comment about the issues of the Latino community a little bit more in terms of Gen Z. And Dr. Oliveira, how about Chicago and the Latino community there? I know it's a mixed community, but a lot of Mexican, who traveled up from Texas in the midstream, what is it, the midsection of the country, the migrant streams there that
Yes.
settled. And then there's a lot of Puerto Ricans there too. And I don't know if you've seen any differences or any, what are the positive messages to give to our communities in Chicago?
I think number one is that the vaccine is safe. That's the key message I think that we need to communicate with our communities. I mean, when we talk about Latinos or Latinx not being a monolith, it's that, immigration patterns do affect how, people see, their communities, right? We're seeing right now how Cuba is having a really hard time with getting vaccinated, and higher amount of Cubans getting, COVID. So, there's larger communities like that. Number one, it's safety. Number two is that we are all in this together. That's the key thing too. Also, what are we waiting for? A lot of people are waiting for time off, like we've talked about issues with work. So, separating a time where you can get the vaccine from your local health center, talking to people who are undocumented and letting them know that it's safe, that they're not going to need to present any of their documentation to prove whether or not they're a citizen or resident of the United States. There's a lot of people in Chicago that are undocumented, but do deserve to get access to healthcare and vaccines. So making them aware that they have rights as well, and that they should be able to access healthcare just like the rest of us. And also the fact that, we've talked about these younger people for me, I was the one trying to get my grandma the vaccine. She didn't know how to access, the internet in the computer, where to log in. And so I was staying up at midnight, trying to go on Walgreens website and trying to get the vaccine for my grandmother in January. So I know very well that kind of feeling where these older populations weren't able to access the internet in a way that this young generation can. And so this is a very savvy generation where they can go boop, 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 and they've already made the appointment for their whole family. And so they're very knowledgeable. And even though they get information from YouTube and social media sources, they also, like Dr. Mancini said, look up their sources. So they are very savvy. Before, we used to have to go to the library. They have access to Wikipedia. They have access to the New York Times. They have access to CNN. They can see when news comes out within the hour, whereas we did not grow up with that information. We'd have to go get the morning paper, review what was going on. And so this is a very smart group that actually, if they really believe in getting the vaccine, they will convince their whole entire family to get on board. The abuelita is going to get the vaccine, their parent, their sister, their brother, their cousin. And if they're passionate about it, they can really change the tables around. And so it's not really depending on necessarily the parents or the grandparents spreading the message. It's that these younger generations, Gen Z, Gen X, are the ones accessing the information and making those appointments for their family members. So we can't, discredit them. They're the ones getting their abuelitas vaccinated, whether or not they believe in the vaccine. Many are taking them to their appointments. So this is the group that's doing a lot of the work for us.
Good. I have to say that our Vaccinate for All campaign has been using influencers.
Right.
And, I did a interview with Becky G, who's a famous, pop star. And I was actually for Google. And the influencers have a lot of communications automatic, like right away, right? Instantaneously. And people then who are following influencers, they in turn want to continue the sharing and liking, et cetera, of the social media. Let me ask you, Dr. Aparicio, have you seen that, the influencers being used with public health departments? And with your public health, you mentioned the Latino caucus is a lot more younger people.
Oh, yes, definitely. So we are really relying on the Generation Z and some of the millennials to do a lot of the work that has for the Latino caucus and it has to do with public health, because we realized that we had to be able to access that community, and we had to be able to be a group that it can relate to. So some of the things are not intuitive for me because I come from a different generation. So I do rely on our younger members of the Latino caucus to guide us at what we think it works, because they as I'm thinking about a webinar, they already thought about let's do it through TikTok, let's do it through Instagram, let's do this with Discord, let's do this to Clubhouse and other applications that I even know about. But it is automatic for them. So we do rely on them to guide us on this respect. And it's interesting to see that the percentage of Latinos on these different generations, like the baby boomers, we were 14%, Generation X 19%, millennials 27%, and now Generation Z, Latinos are 35%. So it's a significant percentage of Latinos in this generation. So I think to answer your question, we are relying on our young members to guide us. What's the best way to reach this generation and bring a message that is accurate, and to encourage them to do the right thing.
So let me just have one last word on the importance of working and in collaboration with Gen Z, either individuals doing video or being part of your social media campaigns, getting messages to the rest of your programs. Dr. Mancini, and then I'll call on each of you, but this is really the end on how to use the important messages that we've heard today and all the data from Dr. Maldonado. How do we use that to get to the Gen Z?
Excellent question. So first of all, thank you again for hosting this. It's been an absolute pleasure. What's worked here for us is a combination. So we have young people, and we actually promoted the Hispanic Medical Association Vaccinate for All campaign in one of our videos. We do monthly videos about the important topics, and we record them in original language, English, Spanish, Portuguese, and then we flood them in social media, Instagram, Facebook, LinkedIn, whatever we can find. But then the key part for us is how do you get them to the testing site? How do you get them to the vaccination site? And that's what we have to work with our partners. So here in Georgia, for example, we have the Latin American Association, the Georgia Hispanic Chamber, and the Latino Community Fund. So these are all very well-known organizations that then get the people out moving. They have the transportation, the childcare, whatever it is that it's going to take to get those families vaccinated. Because the social media can educate, you can give information, you can convince people to make a healthy decision, but we have to follow it up with the boots on the ground work. And then to get it there, then we need those partnerships, and that's what's been working for us pretty successfully.
Great. Dr. Maldonado, Bonnie?
Yeah, I think one of the ways that I am working really is through providers. So I, through my work with the Red Book Committee, the Committee on Infectious Disease from the American Academy of Pediatrics, we represent 67,000 pediatricians in the US, and they depend on the Red Book. Let me see if I have a copy of it here. So this book, we depend a lot on this book for information, and it's online. Obviously, I don't make money off of it. It's I'm just telling you, it's something that's a good resource. And what we're trying to do is make it as user-friendly for providers. We have it in Spanish now too. So it's available in Spanish, and I think it's available in probably 60 different countries now. So there are a couple of other languages as well, but we know that in the US it's available. And we're trying to message with every other week. We have town halls with our providers, and we get between, say, 2 and 10,000 of our members on these town halls to hear about the latest information. We actually work pretty closely, as you mentioned, with CDC. I'm a liaison to the ACIP at CDC, and we work with the FDA. So we try to work with them to make sure that they're getting not forgetting our populations, especially our children, because everything has been geared really towards adults so far. And I get it. It's been a devastating illness for adults in particular, but children are also being affected directly and indirectly. And we make sure that we are in contact with our federal agencies. We do a lot of advocacy work nationally through the AAP as well, and we are partner with many other organizations. And we work in support of organizations like NHMA and others to make sure at the national level that the issues are being raised that are relevant to children under 18 in particular, because that group tends to get left out of a lot of discussions, especially our children, our BIPOC children.
Yeah, no, it's so important, and thank you, Bonnie, for mentioning NHMA. We hope all of you will join us on our Vaccinate for All and Be Champions. But Emma, why don't you tell us about the campaigns that you're involved with? We're very interested in helping and doing what we can to share here.
Yes, thank you so much, Dr. Rios. So basically, in the beginning of January, a group of physicians created the hashtag "This is our shot." And from that, we have tried to focus on the Latinx community with the hashtag Vacúnate Ya. One of the reasons why we chose this is, one, it's get vaccinated, but also, yeah, like we got to do this now. What are we waiting for? This is something that we have to work for. It's basically physicians and other healthcare workers who are focused on giving information that's evidence-based regarding the vaccines and also regarding the infection and what we're seeing. So we put out information in a timely manner, what's going on in the news, and it's from healthcare leaders. So we're elevating healthcare heroes with this. And several use TikTok, we use Instagram, we're using Facebook, we're using Twitter, we're using all the avenues to get that young population interested. One thing that we were talking about is darle un vacunazo al COVID, you know, give it what it deserves. And that's another hashtag that we've used to kind of get that young Gen Z interested in getting the vaccine. You know, vacunazo kind of says like, let's do it. And we're working with the Latino Coalition Against COVID-19, which has many healthcare workers around the country that are doing the similar work as Dr. Maldonado, Dr. Mancini, and Dr. Aparicio, who have been focused on boots on the ground and getting people vaccinated and getting access to the vaccines. So, you know, I've been working with those primarily to do that. And we've been using Clubhouse, as Dr. Aparicio mentioned, which is a new app that younger generation is using to talk about COVID. And so monthly we'll have COVID talks with one of the largest clubs in called Amigos in Clubhouse. But you can see a lot of people tuning in, thousands of people tuning in to physicians, answering questions for a few hours of their time regarding these misconceptions and tearing down these myths. So we're using technology against those that are spreading the disinformation to give people the correct information.
Great. Well, thank you for joining. I want to thank all our speakers tonight, and the National Hispanic Medical Association invites you to come back on the last Wednesday of next month. We will be talking about the variants, especially the Delta variant, and where do we go from here? Here it is right here, variants and uptake of vaccination among Latinos. It'll be same time, Wednesday, August 25th, 7 p.m. Eastern time, 4 p.m. Pacific time. And I do want to say to all of you again, if you'd like to join NHMA as a member. We are looking for speakers for our national conference. We go to our members first, but anybody can provide an abstract. We are especially looking for ways to start 2022 spring. It'll be March 24 through the 27 in Washington, DC area, and it will be live. We will probably videotape everything so that everybody's into virtual, and we know that we don't know how many people will be flying next March, but we hopefully will have a great conference. It's our 25th annual conference, and we're excited about that. And let me just say that we thank all of you for giving us your insights and your, Bonnie, especially with all your data, and keep up all the good work for us at the national level at CDC and AAP. Dr. Mancini, with the mental health, you're a champion for mental health with your big SAMHSA grants, and Dr. Aparicio, we always welcome you with the Latino Public Health Association to help us. And Emma, thank you for being on the ground, and your generation of doctors, which is our, I remember when you guys were all medical students, you know, you're really showing leadership, and also want to thank you for joining and welcoming you to our new Leadership Fellowship. You'll be part of our class that starts next week. So
Super
thank you all.
excited.
Yeah,
super
thank you. Super
I wanted to
excited,
thank
yeah.
Elena for being our leader through this pandemic. All these years of really taking on all of this work and getting the message out and really training the next generation and maybe even the second generation after that. So thanks for all of the work you do.
Oh, no, thank you, Bonnie. And Bonnie did mention to me about announcing tomorrow, the Latino Medical Student Association is having their first leadership meeting for academic faculty, and very much engaging with the next generation to learn from speakers like Dr. Maldonado. And I'll be part of the opening. We're actually receiving, there's 3 of us, one from the Northeast, Dr. Carrillo, Emilio Carrillo, one from the Southwest, Dr. Norma Torres, and myself, originally from California, being recognized as pioneers in we actually helped to start LMSA in the different regions. And then of course we took, when I was at UCLA, we took California's medical student group to the national level and started LMSA in 1987. So anyway, I'm just part of that, but I know that it'll be an all-day meeting, and it was put in the chat. The here, let me just see where is it at? I had it. I don't have it right now. Bonnie, do you have that email?
Yeah, I'll put it in the chat.
It was in the chat. But anyway, I'm sure the LMSA website will have the registry. Here it is. center@lmsa.net. If anybody is interested, it's free. It's all day tomorrow. And it's a leadership meeting. So anyway, thank you all very much. Good to see all of you. And thank you for tonight. And thank you to our staff, Vincent and Sophie and everybody else at NHMA. Thank you.
Thank you, everybody.
Thank you.
Buenas noches.
Uh-huh.
Bye-bye.